Good afternoon, everyone, and I thank you for taking time out of your busy day to join our Eat Healthy, Be Active Community Workshops webinar, making the workshop series a hit in your community. So my name is Amber Mosher, and I am currently a Prevention Science Fellow at the U.S. Department of Health and Human Services, Office of Disease Prevention and Health Promotion, and I'm joined this afternoon by our two presenters, my colleague, Dr. Katrina Butner, and Sarah Burkett from Virginia Cooperative Extension. Katrina and Sarah were both involved in developing or pilot testing the community workshops and are looking forward to sharing their useful insights and experiences that they gained along the way. So these are our three broad objectives that we hope to accomplish this hour. Of course, our focus will be the pilot-tested Eat Healthy, Be Active community workshop series that health professionals and community leaders like yourselves can use all across the country to help others make healthy food choices and be more active every day. So at this time, it's my pleasure to introduce our first presenter, Dr. Katrina Butner from the Office of Disease Prevention and Health Promotion. Katrina has a PhD in clinical exercise physiology and nutrition from Virginia Tech and is also an exercise physiologist and registered dietitian. In her current role as physical activity nutrition advisor at the Office of Disease Prevention and Health Promotion, Katrina developed and led pilot testing for the community workshop series. So welcome, Katrina.
Thank you, Amber, for the introduction. The Eat Healthy, Be Active Community Workshop Series is an educational resource tool that translates key recommendations from the Dietary Guidelines for Americans and the Physical Activity Guidelines for Americans into action-oriented concepts. The series includes 6 one-hour workshops that are easy to use, interactive, and focus on providing how-to tips and resources to help adults adopt the recommended healthy eating and physical activity behaviors. The community workshops were designed to help community leaders facilitate positive eating and physical activity behavior changes throughout their communities. The workshops are intended to be used by a variety of community leaders and educators, even those without an extensive nutrition background. This includes community educators, health professionals, dietitians, nutritionists, cooperative extension agents, and others. On today's webinar, I'm first going to share additional information about the workshops themselves and then discuss the process we use to pilot test the workshops. The workshops focus on 6 broad topics, including enjoy healthy food that tastes great, quick healthy meals and snacks, healthy eating on a budget, in addition to top tips for losing weight and keeping it off, making healthy eating a part of your total lifestyle, and physical activity is the key to living well. While each workshop contains information and tips on both nutrition and physical activity topics, Workshop 6 is specifically focused on translating the key messages from the Physical Activity Guidelines for Americans. This workshop includes a longer activity period, which demonstrates with both pictures and text how to perform various strength training activities. As mentioned previously, the workshops are based on the key consumer messages from both the Dietary Guidelines for Americans and the Physical Activity Guidelines for Americans. This slide shows the key consumer messages from the most recent edition of the Dietary Guidelines, released in 2010, including balancing calories, enjoy your food but eat less, and avoid oversized portions. There are also recommendations of foods to increase. Make half your plate fruits and vegetables. Make at least half your grains whole grains, and switch to fat-free or low-fat 1% milk. In addition, are recommendations of foods to decrease. Compare sodium in foods like soup, bread, and frozen meals, and choose foods with lower numbers. And drink water instead of sugary drinks. Healthy eating and physical activity work hand in hand to help us live healthier lives. This slide shows the recommendations contained in the Physical Activity Guidelines for both adults and children. The guidelines are based upon research which shows how much activity adults and youth need each day or week to achieve health benefits. Adults are considered individuals 18 and older, while children and adolescent recommendations are for youth ages 6 to 17. The Physical Activity Guidelines recommend that adults be physically active for at least 2 hours and 30 minutes each week, that's 150 minutes, and do muscle strengthening activities 2 days each week. Children need at least 60 minutes of activity each day. The workshop series is a comprehensive educational resource tool that includes everything you need to start teaching in your community today. Each workshop is comprehensive and includes several components. The next 2 slides will detail some of these components and provide some examples contained in the workshops. Each workshop starts with a lesson plan, which walks you through each portion of the workshop and gives approximate time estimates for each segment. This is especially important to review prior to teaching to ensure you are comfortable with each section. Learning objectives provide the key topics which will be covered in each workshop. Talking points guide you through the handouts and activities and provide relevant and useful tips. Icebreakers provide an activity for participants to do as they are coming into the workshop. In several lessons, this is a taste test where participants can try some new spices or see if they can identify a store brand canned fruit versus a generic brand. Or this Find Someone Who bingo game, which is shown on your slide, can be used as a way for participants to get to know one another. This activity encourages participants to walk around the room and talk to one another so they can complete their bingo card and learn more about other participants. Hands-on activities are also included. One example is a demonstration of how much sugar is in a can of cola, or using grocery store ads to identify sales and plan meals for the week. This slide shows some of the additional components of the workshop. Each workshop contains several educational handouts specific to the workshop. The example here is on slow cooker tips and recipes. For these activities, it's suggested that you demonstrate preparing an easy meal with only a few ingredients using a slow cooker. The handouts provided within this workshop provide the recipe for the demonstration, as well as other easy recipes using a slow cooker. Each workshop contains a stretch break about midway through the class. This provides an opportunity for everyone to get up, stretch their legs, and do a quick activity. The first 5 workshops also include a short video which demonstrate the key objectives of each workshop. On our website, you'll find the video clips for the first 5 workshops that you can show to participants to support each of the workshop learning objectives. The results of focus group testing in our office highlighted the need to provide learning opportunities in a variety of ways. Therefore, these workshops contain written, verbal, and visual information in the form of handouts, spoken information provided by the instructor, and videos to further help convey key messages. Each workshop was built upon a key 2-page handout. The handouts were developed using health literacy principles and tested in focus groups of adults aged 18 to 64 with various education levels, including those with health literacy limitations. The handouts look similar to the ones shown here and include short personal vignettes to further help demonstrate how healthy eating and being physically active can fit into one's life. The handouts are available to download separately in both English and Spanish on the Dietary Guidelines website. In addition to the handouts and resources developed specifically for the workshops, our office collaborated with the agencies across the U.S. Department of Health and Human Services and the Department of Agriculture to incorporate other materials from successful programs and initiatives into the workshop series. The workshops included resources and materials from the National Institutes of Health, the Food and Drug Administration, the Centers for Disease Control and Prevention, the President's Council on Fitness, Sports, and Nutrition, and the Center for Nutrition Policy and Promotion at USDA. These agencies and offices carry out a variety of nutrition and physical activity initiatives and programs nationwide, and we're grateful to them for their collaboration. Some of the initiatives highlighted in the series include USDA's My Plate, NIH's educational program We Can, food labeling and food safety information from the FDA, and the President's Council's Pala Plus program, which is a 6-week program with specific weekly nutrition and physical activity goals based on the Dietary Guidelines for Americans and the Physical Activity Guidelines for Americans. You can find more information about these and other programs and resources using the links found in the appendix of the community workshop.